All right, we're now recording. I apologize. We're not live streaming as YouTube does not appear to be working, but we'll make sure to upload this as quickly as possible following the meeting.
Okay, well. Welcome to the Government Operations Committee. It is Monday, February 3rd, 5:15. We have around the table, we have Councilors Fournier, Tremble, Councilor Dean, Councilor Fish, Councilor Mallor, Council Chair Pelletier, and Councilor Beck. I'm Councilor Hawes, and we are going to, well, no, we won't now. Councilor Leonard won't be able to.
No, he can participate through Zoom.
Oh, there he
Yep,
is.
he's on
Okay,
there.
and we have Councilor Leonard on screen. We also have Assistant City Manager Courtney O'Donnell at the table. For those that we are recording this, correct?
Yes.
So it will be
Yep.
uploaded later?
Yes,
Okay,
yeah.
all right. We have a fairly lengthy agenda, so I guess we should get to it. Our first item is going to be done, taken care of by Jamie Comstock. She is on screen now.
Hi
Hello.
there. So the first item is a resolve requesting permission to accept and appropriate $150,000 in grant funds from Maine's Office of Behavioral Health for an overdose response program that we have been running at the Public Health Department. I think this is the 6th year. And the grant provides for an overdose response team to make post-overdose visits with people who have overdosed and their family members to try to connect them with supports to help them really. And so it's a partnership with the options liaisons that many of you you may have heard of. It's a statewide group of folks working to prevent overdose also. So we're working with our Penobscot and Piscataquis County options liaisons in addition to the Bangor PD and Together Place, Maine Mental Health Connections Together Place, who provides a recovery, actually 2 recovery coaches for this project.
Are there any questions, comments for Jane? Do we need an actual roll call? No, he's not. on the
No, you
committee.
don't need a roll call, just motion.
Okay.
I would move
Is there a
approval.
Okay.
I will second that.
It's been moved and seconded that we will approve this if there is no opposition. Seeing none. It will not pass it. And Jamie, you also have number 2.
Right. So as part of our work in this on this project, we have a subcontract with Together Place, which is like I just mentioned, they provide the recovery coaching for this. And so we are requesting permission to have the city manager execute a subcontract with Together Place to provide those recovery coach positions. I think this is we've had Together Place with us on this project in a subcontract relationship for a number of years. And I think it was maybe I can't remember, last spring or last fall. This was in front of you also because we transitioned them to providing both of the recovery coach positions. So this MOU will begin January 1st and end on December 31st of this year.
Any questions? Comments? Do we have a motion?
I move passage. Second.
Okay, it's been moved and seconded that we authorize the subcontract.
Thank you.
There's no opposition, seeing none. Okay,
Thank you.
You're
Thank you.
welcome, thank you. Next, Courtney, we have, the presentation by Catholic Charities of Maine.
Yes, joining us, we have Melissa Buchholz and Charles McGabe, I believe. You guys want to come up to the table? I think there's a chair on either side. And I have their presentation ready to share. Want to introduce yourselves and kick it right off if you'd like.
Certainly, thank you. Good evening, everyone. Chair, Pelletier, City Manager, Laurie, and the council. I hope everyone is doing well. My name is Charles Mugabe. I'm the Director of Migration with Catholic Charities. I'm here with my colleague Melissa, so I'll let her introduce herself.
Hi, everyone. My name is Melissa Buchholz. I'm the Assistant Director for the Refugee and Immigration Services Program in Bangor.
So, in my role as Director of Migration, I oversee our refugee resettlement programs across the state and also our asylum seeker transitional housing program in the southern area of Maine. Today, we are strictly going to speak about resettlement offices and work up here in Bangor. Catholic Charities, we've been doing our work for many years. Resettlement alone, we started in 1975. We currently have more than 24 programs across Maine. We have support and recovery. So when somebody was presenting about that, it hit me right at home. We have behavioral health programs for adults and children. We do food pantries up in northern Maine. Refugee programs across the state, asylum programs, and other type of work to support vulnerable communities in Maine in general. We serve individuals from all walks of faith, regardless of their background. I'm going to pass it over to my colleague Melissa, who will walk us through the presentation today.
Absolutely. Thank you for that introduction, Charles. So I'm going to talk specifically about the Bangor office and the Refugee and Immigration Services Program. And to start that off, I usually start by talking about who we serve. So the main population that we have served in the last 3 years of the Bangor's operation has been refugees. So refugees are folks who are vetted by the government before they even arrive in the United States. Oftentimes, folks, they leave their original home. They have to flee to another country due to fear of persecution. And then while they're there, they sometimes are opted to resettlement in the United States. Now, this process is a lengthy process. Oftentimes folks stay in that second country for about 10 to 15 years. And then when they are resettled to the US, that's after they have done through all of their background checks, medical checks, which occur through various federal agencies. And then when they arrive to the US, that's kind of when our services pick up, and we work with folks from when they arrive, they're actually eligible to work. There's always a fun fact I add. So if I had a job, the moment someone arrived off that plane, they could start working. I usually give them a couple of days to maybe get over that jet lag, but I could do that if I wanted to. We also work with special immigrant visas in a general way. Our office has not worked with any folks having the SIV or special immigrant visa status. It's basically folks who worked with the US government in Afghanistan or Iraq. Additionally, you'll see that I have it divided into kind of this blue category and yellow category. In general, it's just because they're funded by different federal entities, but they're all funded by the federal government as well. So that's why it's divided, in case you guys are curious. We work with asylees as well. So asylees are folks who not only have sought asylum or have gone through the asylum process, but were then approved for asylum. So they're not in that process, but they have been in that process, gone through that vetting, so to speak, and we're eligible to serve them in our office. We work with secondary migrants. This is basically just refugees who were settled somewhere else and then maybe heard about Bangor, want to start a business, and come to this area. It's only called secondary migrant because they first were somewhere that wasn't here, and then they moved here as they have the right to move throughout the United States. Thirdly, we also work with victims of trafficking, which is, as it sounds, we haven't served any of these populations in the Bangor area, but they are a population that would be eligible for services if they were in our area. And then lastly, we work with human patient entrances. These are folks who are granted permission to live in the United States, basically due to some humanitarian reason. And I will also just clarify, we do have time for questions and answers at the end if something's sparking a question in you guys during this so far. Excuse me. So when looking at the populations that we've served so far, we've served for households, we divided it into just refugees and Cuban Haitian entrants. So those are the two populations that we worked with this fiscal year. Now, when talking about the fiscal year, I'm talking about last October until now, which has been about 4 months. So we've worked with 14 households in total. And in those households, that included 19 adults and 3 children. This is just divided in a way to kind of see how they differ from adults and children within the refugee and Cuban Haitian entrants categories. And I have another graph to kind of highlight that a bit better. So basically, to sum it up, we've worked with about 2/3 of our population in this fiscal year has been refugees. And a little bit less than 1/3 has been our Cuban Haitian entrant population. And looking at these populations and just kind of where they're coming from, it's been pretty well divided within 5 different countries of origin. The biggest one being Haiti, followed by folks from the Democratic Republic of Congo, as well as Venezuela, and also some smaller portions from folks coming from Nicaragua as well as Afghanistan. And when looking at the languages spoken, it's pretty representative of the countries they're coming from. So the biggest one being Haitian Creole, as that's what folks who are coming from Haiti speak. With Spanish being the next one, as we have quite a few folks speaking Spanish, and then a little bit of folks who speak Kiswahili and Dari is a language from Afghanistan. All right, this is something we put from the previous fiscal years in comparison to this fiscal year as well. Like I said earlier, we've been operating for about, this is our 3rd fiscal year in Bangor. So this is just comparing how many cases are families and how many cases are individuals. You can see this year is actually quite comparable to previous years, where usually there's about double the amount of individual cases than half the amount being family cases. This year has especially been a lot of smaller cases and individuals that we've had so far, which has been interesting. And just seeing how, like I said, it's only been 4 months, so just seeing how that's kind of spread out in those 4 months. In October, we didn't have any arrivals. We had 3 people in November. We had 9 people in December. We had 3 people in January. And I'll give this to you, Charles, to talk about this.
Absolutely. Well, looking ahead for our office in Bangor, there's been multiple executive orders, and there are a couple of those that directly impact the refugee resettlement work across the globe, really. So first is the executive order labeled Realigning the United States Refugee Admission Program. This specific executive order states that refugee resettlement does not align with the interest of the United States. And as a result, the refugee resettlement was suspended for 90 days. So the 90th day will be April 20th. And the goal will be that Secretary of Homeland Security and Secretary of State will have to submit a comprehensive report to the White House demonstrating that the program is indeed aligning with the interest of the United States. And that means if the report does not indicate so, the program will continue to be suspended for another 90 days until another report is produced. So we do not have a clear sense of when the refugee resettlement will resume. And so this executive order, the fact that it's still in place, means that there is no refugee resettlement happening now or within the next 90 days. Now, we had roughly 14 individuals that were scheduled to travel to Bangor in this month of February. And so we got notifications last week and the week before that these flights were canceled. And that was mainly as a result of this executive order. Flights across the country were canceled, and families who were even about to travel had to be left behind wherever they are in the refugee camp or in their country of refuge. For our Bangor office, despite the executive order, will remain to be operational and serve the current cases that we have, the current families that we have. Because what we see is that ultimately the families that are here, the families are the collateral damage despite all these situations. And so Catholic Charities, we've been extremely privileged to be in position to serve these families, and we'll continue doing so with those who are here. So our office will remain open. And also the other populations that we're committed to serving are those who walk through the offices by themselves to come and look for help. And so our office will remain to provide assistance to the refugees that already arrived and those who will be walking in through our office. And then lastly, if the resettlement resumes, if the refugee processes resumes, we will expect to have a maximum of 115 individuals. These were our approved numbers for the fiscal year of 2025, which started October, as Melissa mentioned, ending in September 30th. So if it resumes, we'll have a total of 115 individuals as an expected arrival. The actual numbers of arrivals depends on the presidential determinations, depends on the executive orders, depends on multiple factors. It could be that by end of September, we have 0 arrivals in addition, as opposed to what we already have right now, or it could be that the refugee resettlement resumes and we just have a handful, but we do not know. It will all depend on what the White House will decide after reviewing the report from the Department of State or from Department of Homeland Security. So that is really what we're looking at ahead is the program will continue, but the refugee resettlement will slow or nearly pause until we hear otherwise. I'll pass it back to you, Melissa.
Thank you. And then the next section I was going to talk about was just employment services. So far this fiscal year, we've had 12 employable adults. We define an employable adult as someone between the ages of 18 to 64. Of those 12, we've had 6 job placements who are joining the main workforce. 3 of them are participating at Job Corps training as they meet those eligibility requirements. We have 1 individual who is actually pursuing a job with the police academy, and 2 individuals who had just arrived in January and are working on their employment. And actually, by the end of this week, they have an interview, so we're hoping that all 12 will be in a job placement or a training program, which is pretty fantastic. The employers include the top one was Topnail, Walmart, and Eastern Basements. And then I also have this graph just to talk about all the different employers we are working with, as there's quite a variety, not just 1 or 2 that we are working with. Additionally, what's also kind of cool that I didn't show in this presentation is also folks, these are the jobs that people have when they first arrive. But after folks have been here for a while, those jobs often change into more maybe professional, more skilled work as they get new skills, learn more English. We've had some folks who have started businesses in Bangor. We've had some folks who have moved up in their career and changed jobs that have been more in line with skills they might have done back in their countries of origin. And then lastly, just talking about refugee community integration. So some strategies that we've seen to be quite successful with our population, also some barriers too that we are experiencing. Some strategies supporting community integration is more employment and workforce development. That means just finding different employers and training programs available to our folks that align with their skills and strengths. Another one is focusing on financial literacy. I think we all could obviously benefit from that. So just making sure we align kind of how budgets are operated, how to identify what are some key things to spend money on, and also preparing for saving money for future things such as a car or something like that. The third one was English classes, as a lot of our folks you see are working. Those classes don't always work if they're during their work hours. So finding flexible English classes, whether that's after work or on weekends or before work. And the fourth is landlord relationships. So building relationships with landlords and showing how a lot of our folks, how they are reliable tenants, paying their rent on time, being good neighbors to the folks that are living nearby, which has resulted in 100% of housing placements. On the flip side, there are also barriers, of course, with resettlement and community integration. One is lack of affordable housing. Kind of highlight that more. I had a recent family that after paying rent had about $20 left, and that was $20 for bus tickets, for non-food items, for work closed. So just how that affordable housing is the essential part, which I'm sure you guys all are aware of. But just how that is looking within our families. In the relation to that, as well as just smaller cases, as these smaller cases have more of a limited budget, if it's just a single person finding, a room in an apartment and finding different ways that folks are able to afford places that they are living in. The third one is misinformation, specifically about refugee populations. When folks are both in their original country before they come to the United States, as well as when they arrive here, they're given what's called a cultural orientation. So that's before they arrive here, talking about US culture in terms of employment and health and law and how to be safe. And that's also happening here too. So our folks are well-informed, responsible, contributing citizens, and making sure that those messaging are being spread and throughout this area of talking about who refugees are and what they're doing here and what they're contributing here. Second to last one is about rental requirements. So finding an apartment, as you can imagine, the main things you usually need is like a credit score. You need previous rental history. For our folks who haven't lived in the US, they won't have a credit, and they also won't have rental history, at least one that would be translated, so to speak. Right? If they're living somewhere that doesn't speak English, you can't call the landlord and say, are they a good tenant if they don't speak the same language? So those are just some barriers, of course. And then the last one is just work appropriate gear. I put this in when talking about affordable housing, about that family that had about $20, just focusing solely on rent. And if they found a job, like making sure we're finding adequate resources for them to have the clothes that are appropriate for working that job, such as like steel-toed boots or work appropriate clothes. As oftentimes when people arrive, they just have a luggage of their clothes that might not always include the very varied jobs they might have in the US when they're packing. I thought I could give this time for questions and answers. If anyone had any questions that me or Charles could answer.
Any questions? Council Fish?
I have several questions, so I'll just ask a couple because I'm sure other chairs or other councilors have questions too. In the last couple of years, I know in the greater Bangor area, I think we started placing refugees around 2023, and I think at that time there were around 100. Or they're about 84, maybe, or in that category.
The last fiscal year,
Yeah.
there's around 90 folks that were here.
90. And of the 90, how many people became employed, and did it take? I know Catholic Charities helps them for about 3 months, correct? And then what happens after 3 months? Are they employed? Is 50% employed? And what happens to the others?
That's a great question. I can take us out. Charles, you can add anything if you had something to add. I actually do remember the data for last fiscal year, which was, I guess, good in preparation for this. About 85% of our clients were employed. Of those folks that were employed, some folks were had a disability that prevented them from being employed. That was a few of our clients that had that when they arrived here. And as for how long our services last, we are actually eligible to work with clients up to 5 years, which is pretty great. The first 3 months are usually like a very intensive period where that's getting everything in order, registering children for school and getting in English classes and things like that. But we're actually around for 5 years to help with not only the first employment, but also additional employment that might happen after a year and someone's looking to kind of change careers or fields that they're in.
Yeah, there are 3 key areas where we concentrate our services on. One is wraparound case management work, right? The benefits, schools, English registration, so on and so forth. The second one is workforce, and that is the employment piece. And then the third is health navigation. Health navigation and the wraparound case management is concentrated within that 90 days. However, the workforce piece is extended up to 5 years. So they can jump in and out depending on their situation, because they may have a job today and then they're laid off. We need to restart. So the workforce one continues for up to 5 years. And that continues to be something that we're still working with almost everybody who is eligible to receive that support. Yeah.
And Chair, may I continue? Would you like the other councilors?
Others that,
Yeah, I'll ask questions, but you go ahead.
With with the other partners that I'm sure you must be working with, because it seems like they would need to have a lot of collaboration with health and community services and other goods as well. So I would think that the cultural center, the multicultural center here in the Greater Bangor area would be key. The city itself must be involved with some coordination. And what departments do you see are most, that you work with the most and most helpful and most supportive in being able to make sure this transition is successful?
Yeah, you're completely correct in saying we work with a variety of different community providers. I don't know if I could even list them all if I was trying to right now. Something that's really supportive for the integration piece is, of course, having interpretation services available. I think that's a huge one. So making sure folks, if they're entering a program, whether that's a program with the community health services or DHHS or the school department, having the interpretation services available, which they are available and have been working well. To add on to that point, I think the coordination piece has been really huge as we've kind of developed that over the last 3 years of not just referring someone there, but also following through on those referrals. So making sure that if there was a language barrier or something that folks didn't understand, that they're able to be connected to those resources.
And with housing, I would think that you must have, is there city housing or Main State housing, or is it all other nonprofits involved with the housing, or is it a pretty much private landlords that are involved in your housing?
That's a great question as well. All of the landlords we work with are private landlords, so it's just having the general, I think, access to the housing market as well. So none of our folks are receiving any subsidies or Section 8 housing in this area.
I'll take a break. When we-
Okay, I want to go back to the beginning. Catholic Charities covers 100 miles as the crow flies around Bangor, correct?
Correct.
How many placements are you doing in the other cities in this 100-mile area, like Augusta, Waterville, Lewiston?
So we have 3 offices. We have one office here in Bangor. We have another office in Portland and another one in Lewiston. Portland and Bangor offices, their 100-mile radius is acceptable for placements. So we've been placing families. Portland office has been placing families in Augusta. We've placed families in Fairfield. We've placed a small number in Romford. And for us, for the Bangor office, we've had families in Bangor, in Old Town. Can you remind me if I'm missing any other city?
Also a few.
Or no, yes, yeah. So we do place individuals and families in different cities. The key challenges for us that we run into is housing. And so places like Portland, for instance, where we have our Portland office, housing is extremely scarce. Places like Bangor, housing challenges are observable. And so we work with landlords where there is housing and we place individuals there. In the process, we make sure that there is resources. They have access to adult education so they can improve their languages. We make sure they have connections to employers so that they're able to get their job, so that they're also connected to the hospitals, different type of services that were required. Through our federal government contract, there are what we call core services. And these core services must be completed within 90 days, and we need to provide a report on individual families on how they're delivered and whether they were delivered on time. So we ensure that we place them out into housing first and then work through those core services so that we can do a report by the end of it. So we work with multiple cities beyond just Portland.
I didn't hear you mention Waterville. Do you work with Waterville?
Oh, yes, we do. We have, in fact, there are multiple Arab families that were placed in Augusta who then moved to Waterville. And then now their families have started arriving to the United States, and we have to place them close to their families. So yes, we've worked with Waterville as well.
Now, what percent of the funding for the refugees would come directly from Catholic Charities as opposed to other organizations?
So the percentage of funding that comes to us for services, all of it is federal funding, because our work is a federal funded work. None of the private organization provide funds.
That wasn't necessarily what I meant is we have a group or a family that arrive,
Yes.
okay, and they require services. Of the services they require, what percentage do you fund?
Okay. It is slightly hard to tell, but what I can say is that the federal funds that we have and the core services that are required, it covers almost 90% of what everyone would need. There are small exceptions of things that we cannot do because it's not within the core services. But I would say everything from applying for state ID, taking them for grocery shopping, taking them to hospital, some of the daily needs are part of what we're required to provide. And then we also have a limit to how many times we do that. So for instance, if we're doing grocery run for you or going with you to do it, we're supposed to teach you how to do it and show you how to do it and do orientations with you so that eventually you can take over that responsibility by yourself. I would say that's where we've seen challenges for some families, but others assimilate very quickly. But we are covered to serve almost everything that a person would need in order to adjust into a new community.
Now, obviously, language is a difficult problem sometimes. Do you provide any services to the local schools?
You mean funding to the local school?
Right, I mean, I'm just looking at this as, we're expected to take the children to the school if they're eligible. And the costs for educating these children because of the language difficulty is a 100% responsibility of the municipality. You do not participate in that, is that correct?
So that is mostly correct. Catholic Charities, one of the 24 programs, is a program called Office of Maine Refugee Services. And this program has an individual who is a designated representative of the federal government. So long story short, what this office does is it funnels some of the federal funding meant to support assimilation of refugee population in cities. And that funding tends to go to the schools where children are located at. It tends to go to schools where adults are located at as they're learning, so that it can help boost the capacity of those schools. Because it is true, new population with new language presents new type of challenge. And the federal government understands that through the refugee resettlement path. And so that funding, every year it goes to the schools. I would say, as we've all been seeing in the news and hearing, some of the funding cuts, very explainable, but some of them are impacting operations such as this. And so funding that would ideally go to school to support some of these initiatives are no longer there. But every year it is included in part of the federal budget, and Office of Maine Refugee Services that lives within Catholic Charities administers this funding to schools every year. Yeah.
Do you try to assimilate the refugees in groupings so that we have the bulk of a particular language in an area to make it easier? I notice we have 5 languages you're dealing with in the Bangor area. I don't think we have 5 teachers in the school system that can teach these. So it gets to be a great expense for the municipality, and I don't see any major funding coming to help us with that.
True. I can speak to the overall objective piece, and Melissa, I want you to give examples of what we're doing right now. So with the refugee resettlement, we do what we call abstract, which is an analysis of capacity. As part of the abstract, we consult city managers, we consult city officials, we consult the schools, we consult different decision makers in the area to make sure that as refugees arrive, that the capacities are there to serve. If the feedback is that there is no capacity, we usually send that exact feedback to the federal government. So we do that abstract every year. Now, part of that obstruct too is that if we identify, let's say there is Hispanic community in the Bangor area or Haitians, then that becomes the main group of individuals that are being resettled. So that we're not creating a whole new community, but just building on community that already exists. Last year, we received a number of Arabic speakers, and the year before it was the same. And so that our goal for this year was to say, hey, let's receive more of Arabic speakers because they're already some members of community who speak the language, who also speak a little bit of English and can help. So our goal is always to tally them based on the community that's already existing. Melissa, do you want to speak to how we're connecting with the schools to ensure that folks are placed together and what help people are providing between each other language-wise?
Yeah. So a couple of things too I wanted to add about the languages. We also have folks that their original language might be one of them listed above, but also speak a lot of English, especially this fiscal year. I think half our clients speak a pretty from decent English to fluent in English as well. I realized I didn't probably emphasize that when I was presenting, so I'm glad you asked that question. In terms of kind of facilitating the processes of being connected to different agencies, especially with folks that might not speak English. We've worked well with the Maine Multicultural Center to kind of help with that process, as well as being more of a soft handoff for folks when they get to the school departments. So working with different school departments around this area to make sure that transition from them going to school is more fluid as well.
Mhm. I'll just add one other thing. We've been collaborating closely or communicating closely with Department of Education. There is a funding that's a federal government through Department of Ed. It is associated with Title I. And that funding is also meant to do the same type of work to support school capacities with ESL students or ESOL students in their districts. And so we meet with DOL quarterly to make sure that they're aware of where we're doing the placements so that they know that those areas might have needs. And we also bring it up to them and say, hey, we have new people in this new community, they will have needs. Please provide funding to them. That's in case we can do that. For instance, within this timeline, we are, some of the federal funding have been stopped. So we're working closely with DOL on that end, but Title I is a great resource. And Department of Education can support districts with that. Yeah.
That's reimbursable the year after it takes place at a reduced rate, isn't it? I'm just curious, the only reason I ask the question is I find it difficult pill to swallow.
Yeah.
When we have people coming, and I have no problem with the refugees coming in, but when we have people coming in that require language taught, that require special teachers in school, when we have a population of students in school now that aren't getting adequate training because we're on the bottom of the list for education. So you're just creating an extra burden for us, and you're not really helping the refugees any.
Mhm.
I mean, if we were a top grade education system and we were funding it well, it would not be an issue, but it isn't. It is an issue because we're not doing that.
I hear what you're saying, and it totally makes sense. And what we can do in those cases, in fact, I would like to invite you to one of the quarterly stakeholder consultations that we host. We always want to hear that type of challenges that districts are facing so that we can then raise it in the right places where there could be funding, because we know it is necessary for there to be more support for the school districts. We've tried as much as we can with many of the districts across Maine, starting from Biddeford, Augusta, Waterville area, coming even up here in Bangor. There are multiple providers that we've had contracts with. But just as this year, when the funding constraints has come forward, that we're facing these challenges too. But in that consultation, we would love to collect more of your thoughts so we can have an accurate representation of what the need is on the ground.
Oh, yeah, I do have one more question. I'm sorry. I was looking at, now define for me because I was a little confused, and that's easy for me to be confused. What qualifies as a walk-in?
Great question. Melissa, do you wanna?
Yeah, so with refugees, we kind of know their information prior to them arriving, whereas a walk-in would be someone that's just living in the area and looking to receive services. For instance, I talked about a secondary migrant. That would be someone who was originally resettled somewhere else, so then moved to Bangor. So they'd be a walk-in client, because I didn't know they were coming. I didn't call them and say, hey, come to Bangor. It's a great time. There are folks that just arrive here, and when they arrive here, then they ask to receive services.
But there would probably be someone you'd already had services for a walk-in. I'm just looking at walk-ins as someone that comes in legally or illegally, it doesn't matter how. That just arrives on your doorstep and you have no idea who it is or where it is, or where they came from, asking for services. Does that happen often?
In a sense, yeah, it's folks that we wouldn't know about. I wouldn't know about these folks until they
Right.
walk in, and then I look to make sure that they have eligible documents for these programs, as this is all federally funded. And if they are, then we would provide services.
So, but you have to provide the data, I mean, the information that they need to get involved with the services. That's your job. To provide them with all the credentials that they need, or do they come with credentials?
Oh, that's a good question. So they come in with the credentials. I would be just connecting them like as a case manager to
Okay,
services.
so that gets me back to where are they getting the credentials to come with? I'm not trying to give you a hard time, it's just very confusing. I mean, someone arrives at your door and they have credentials, well, where did they get them?
Yeah. So sometimes they do, sometimes they don't, right? So, for instance, in the Bangor area, we talked about Haitian communities as an example. They could inform another Haitian family just down there in Massachusetts or down in Florida, please come to us, we can help here. And when they come here, we do not know whether or not they're coming. We don't know who they are. We don't know anything. We only meet them when they come to our office. And that's when we learn about them. So we assess whether or not we're able to serve them, and we share that with them. So the piece about credential, there's so many immigration status that exists, right? We have students who are at the university. We have people who come for work reasons, because of their unique talents. We have people who come to just visit. Those folks are expected to go back. We have Haitians who arrive because of the humanitarian concerns in their communities. We have refugees, we have asylum, so we have people who are victims of trafficking. They were trafficked into the country, presented themselves to the officers, were granted that certification and eligible for services. So all those immigration status, not all of them are eligible for our service and support. When somebody presents themselves, we look at their credential, and most of the times they don't have it. Sometimes they have it. And when they don't have it, there was an excellent question about partnership. We then connect them to a fellow partner who is able to support them. But if they have the right credential, we make sure they're connected to those resources and support, because we want them to also be successful so they can start contributing and supporting and join the community. So that's really our goal. But to your point, walk-in is indeed somebody we don't know about at all. They just show up at the door. Yes.
So the population served so far this year does not include any walk-ins.
Great question. So you wanna?
Yeah, so the walk-ins would be the Haitian community. Those are all folks that we didn't know about prior to them kind of coming up, walking into our office and asking for services.
So of the 15, you're saying that they,
Yeah, of the 15, 7 would, or of the 22, 7 would be Cuban.
walk-ins?
Yeah, walk-ins, and 15 would be refugees.
Thank you.
Absolutely. Great questions.
Council Beck.
Yeah, so I'm curious about the average experience for someone who's being integrated. How's it been? Have they been feeling very welcome and excited to be part of their new community?
Yeah.
Yeah, I can speak to that. Yeah, definitely. I think one of my favorite parts is when folks first arrive. I've done this many times. They're like taking pictures of everything as we're driving through like downtown. I often will make sure they know where, where downtown is, or, how to access different, things just in their free time, like going for a walk around the river or something like that. A specific example that I was thinking when you asked this was as most of you know, the situation in Syria, has changed in recent years. And someone asked one of these families, actually wasn't me, about like, would you consider going back to Syria? You've been here for a couple of years. And he said, no, like Bangor is my home now. And just that like word, I was like, I think that's really nice to hear that folks feel like this is their home, as they've been able to feel that as well.
So are you finding that most of the folks you help settle here, they're staying here?
Most of them want to stay here. And the refugees are usually unique, not everyone is unique in their own way. But the refugees are driven out of their home for humanitarian crisis, like war, like real-time war. To the degree where if they were to go back, they'll be in harm's way again. And some of them already have families back home, they're in harm's way and they're calling them, please, what can you do? So most of them want to stay here and make home their home really. There are very few who are ideologists that want to start business and want to go back, build more business back home. Some others who have visions, especially among those important that I've met, have visions to go back home and do something good with the knowledge they've accumulated and all of that. So some want to go back, but I say majority that have kids are just looking for second chance to begin new life. And in a way, Maine has been that.
And I can even add to that too, of out migration within the last 3 years as I've been here since the site started. So I kind of have a knowledge base sometimes in my head. We've only had about 5 individuals, I think. So 5 people total that has out migrated in those past 3 years.
I'm just connecting the dots here and I'm seeing, from the presentation, I'm hearing that, they're trying to get better education, they're getting jobs and they're trying to get better jobs. So all of the services and things that we're providing for them sound a lot like investments. And so as they stay here, as they grow in our community together, because they're part of our community now, it sounds in the long run, they're given a lot more than they're getting. And I think we should all appreciate that. So I appreciate it. Thank you.
Thank you for saying that. Yeah.
Council Fish?
Thanks for coming in. This information is very helpful. And I know and I want to apologize for all my councilmen, and it's going to be a long night, but this is very important. So, these are going to be some tough questions, but one of the slides, the topics was misinformation. And in the past year or two, I think this was kind of a surprise last year when it sort of hit the media. And I think that there's a lot, some things that have been brought to my attention. So I've got a couple of tough questions and I think it might be just good to get them out on the table.
Sure.
Do you know of or heard of or been involved with some refugees coming into Bangor or Greater Bangor without coming through the proper portals, especially in the last couple of months since Trump got voted in and people are wanting to expedite and maybe not go through the process and sort of coming into Bangor without housing?
Lisa, have you heard of that?
I have not heard of that. So all of our folks, all the refugee folks we work with, have all that proper documentation that we were talking about. So I don't really know.
So you've not heard that or been involved or nothing? This is kind of a surprise comment.
It is, and
Okay.
I'll just add that the refugee process is so meticulous in a way that it starts while they're still overseas, right? While they're still overseas, they're working with the local governments, and then eventually the national groups are brought in to facilitate some of the refugee process, and then afterwards there are some global network brought in to facilitate the process, and then eventually United States is involved. So USCIS agents facilitate the process. By the time they finish everything overseas, there is a unique group that is meant to escort them through all the airports until they arrive here. And then we pick them up at the airport. And so by the time we pick them up, they have everything that they're supposed to have as refugees. Now, there's usually refugees, everybody could be labeled a refugee as long as they're leaving a place. And so that might be one of the things that I would just flag. It could be that somebody does not have a refugee status, but it's just because they might have fled something and are here and they're called refugees, that's what might have
And it
happened.
could be something not involving you at all.
Absolutely, yeah.
And then lastly, this is great. We have a workforce issue even here in the Greater Bangor area. And just a few weeks ago, matter of fact, I had to have a roof put on, and we had some, I don't know if they were refugees, but I know we couldn't speak the language. What we did was like coffee, you know, donuts, and thank you. So, and they did a great job, and if it wasn't for that workforce, I don't know when I would have gotten my roof on, so. But you know, at the same time, we represent Bangor, we have a housing shortage, and we have our own unhoused community.
Yeah.
And especially if you talk about 100 or 150, you know, people or 20 or 30 or 40 families, that's significant for the towns when we have unhoused people out on the street. And so it becomes, you know, a concern to, you know, and it becomes a concern to us as well. So thank you for coming in and sharing the information. And just one last one, again, to maybe put away some misinformation.
Yeah.
Have there been other hospitals and communities who have rejected or refused to work with you because of health concerns that may be related to what they feel refugees have not been vetted medically and are bringing in and claiming that there may be an uptick in measles and TB as a result of the vetting on the health end of it not being sufficient enough, and are there hospitals and communities rejecting working with you because of that?
To my knowledge, we work with a specific hospital, and I have not heard of anything about that. Prior to folks when they come here, along with the security checks that we've both been talking about, the medical part is a significant part of that, and so they go through those intensive medical screenings before they arrive here, just for that in a way.
Okay.
Yeah, just want to add that the refugee screenings, health screenings that we hear about, those are screenings that were recommended by US CDC to the government for the refugee resettlement operations, and portions of it, actually a big part of it, is done overseas. And then by the time they come here, they have to continue with those processes. Some of them get additional injections, additional health checkups to ensure that they're thoroughly screened. And I would reference back again to the same message as before, that by refugee, they could be referring to other people who just came here. And for those individuals as asylum seekers or those who have just entered, they're not as frequently screened in this manner. We have worked closely with many hospitals in the southern Maine, but also up here with PCHC to sort of work with them to institute a standard health procedure. The ones that we do for refugees, we encourage them to do for everybody that they see, right? And that way, at least people are getting the essential screenings done as soon as they arrive. The ones in southern Maine have been doing a good job. Almost every asylum seeker that we meet right now has gone through that process, but I'm not sure about how that is going in Bangor. I'm sure that will catch up. So we haven't particularly experienced that. I haven't heard that information yet. The refugees we're working with is fully screened, and we have a contracted provider here who, to your point earlier about funding, because the funding is needed for school, for health services, who are also running into similar issues with languages and capacity. So we provide a discretionary fund to hospitals to provide that type of work and share with us the challenges they see. So we haven't heard of this directly related to our population. Yeah.
Very good. Well, thank you very much. And, you know, the schools, I know last year when we had a joint meeting, I believe, it was quoted something like 43 different languages or something at our high school. And so, you know, in the last 2 or 3 years, that's pretty significant for our community. And I know there is some grant money and there is some supplemental money to help with that. Thank you very much. And I'm done, but thank you for your answers and coming in tonight.
Thank you.
Any other questions, comments for those who have not had any? Council Leonard, are you all set?
I just have a quick comment. I know you
Sounds good.
presented earlier, when was it last?
Last September.
Yeah, last fall, and I got over the terms, and you could quiz me now in asylee and legal status, I wouldn't know any of them still. I'm getting closer though, it's a very confusing vocabulary, but I think this is helpful, I think we're all getting closer to understanding the population everybody's dealing with. And so it's great work you're doing. So thank you for coming in.
Thank you, and we appreciate that you invited us back.
Mhm.
And we know this work can never be done by just us. It's a teamwork type of thing, so please expect outreach from us. And I'd like to really invite any of you, if you have time, to join the stakeholders consultation meeting that we have quarterly. There we talk about the landscape across the state, and then you can also ask some of the questions and concerns, because we really collect them and submit them for reporting purposes to the federal government. So your input would be helpful as we go through this entire process, because it's challenging.
Okay. Thank you so much.
Thank you.
Thank you. Thank you.
Let me, number 4, we have a annual report.
Yes, just really quickly though, I think it's 43 countries that are represented in the school, not languages, just so everyone knows. And I believe Katie Bryden, the current, I believe, vice chair of the advisory committee on racial equity, inclusion, and human rights, is here to present the 2024 annual report.
Thank you very much. Thanks for having me. We have a couple members, Gabrielle, Melissa, maybe you're tired of being up here. You don't have to come on. Yeah. We have a couple members here, which is so serendipitous to be able to join and share our annual report. So quick overview from the Advisory Committee on Racial Equity, Inclusion, and Human Rights. We're going into our 5th year since being appointed by the City Council as an advisory committee, which many of you were on at the beginning. To provide a support, insight, guidance, and help in any way possible to ensure that the issues of racial equity, inclusion, and human rights are at the forefront of what is happening in Bangor. So our 4th year is where we really sort of did the almost like boring meat and potatoes, really streamlining what it is that our committee should be doing and how we can address it by identifying work every single meeting, our monthly meetings, that we would identify policy, ordinances, education, and events that need to be happening to really advance some of the equity work that's happening in Bangor or needs to be happening in Bangor. So around those policies, we've created subcommittees, and our subcommittees have created some really awesome partnerships, presenting at Pride, where we were able to engage with a number of Bangor citizens, share our work, ask questions. What do they want to see? What do they want to get out of this advisory committee? How can we better support it? Having meetings with the Downtown Bangor Partnership and with the Bangor Chamber of Commerce to share ways about how we can make Bangor more inclusive, especially in terms of access, with disability access. If you're using a wheelchair in downtown Bangor, are there ways that the city might be able to, is there funding available? Do you know that that funding is available to these business owners, that we're able to sort of bridge that gap? Additionally, working with the ordinances, providing feedback on the most recent naming ordinance, which we were just here to talk about. And we hope in the future to really build on these partnerships with the NAACP, Maine Multicultural Center, and especially with the Bangor Historical Society too, just making sure that we're really looking back into, especially as we evaluate some of these naming ordinances, where do these names come from? What is the history behind them? Can we surely say that these are the right names and the right people to uphold in the places that we are celebrating in Bangor? So we're excited about our future work with that. We've got some really obviously great individuals that are on the committee, and some really great work too that's being done on those subcommittees for our events and education, resources and accessibility, working with Courtney on the new website, making sure that all of that language is clear, and also accessibility in terms of disability access through tech, what is being reviewed, and how can we better provide feedback to make sure that it's accessible, and everyone bringing their very unique and passionate lens to this work, so that there really is a very wide scope of how we can support all of you and your work. And I hope that we obviously can continue to engage even more in terms of seeing ordinances and policies we can provide feedback on. Do you have anything to share, Gabrielle or Melissa? Y'all talked out?
Yeah.
back to the table. Anything that I missed in terms of overview of the report that you'd like to share?
I think you nailed everything.
Yeah.
Yeah, thank you.
Yeah. Are there any questions from you all?
Questions, comments, Council Beck?
So under the goals for 2025, I see that you put down that you want to foster greater involvement from the Bangor City Council to ensure alignment between committee initiatives and city goals. I guess my question is what exactly does that look like?
Sure, thank you. Thanks for asking that. Over the past 4 or 5 years, we've had involvement, obviously people that have started on our committee, moved up to city council, having council chairs come to our meetings, provide feedback. We would love there to be a more proactive way that we can get engaged, that we can learn about what is coming, what you're all going to be seeing coming down the pipe. What lens can we offer to provide feedback? And if that is having a member from the city council participate in our meetings on a monthly basis, I already know you're in 1,000 meetings, so it could be on a rotating basis or something, so that we could have, we would have a better idea of, if I'm being blunt, it's felt like the past couple of years have been very retroactive in our work. We're providing feedback on things that already happened versus knowing what's happening, what you're working on, where your goals are, what we can provide feedback on and support. Go ahead, Gabrielle.
Yeah, just to extrapolate on that, as an advisory committee, we want to act as an advisory committee to the city council. So we want to be available to provide advice. We want to be able to provide guidance, recommendations. We are members of the community. And as being members of this advisory committee specifically, we want to be able to provide input on what's being discussed at city council meetings and what's being considered. Like my colleague said, Katie said, we want to be able to provide that kind of feedback, guidance, and advice. So let us be your resource. That is what we're saying. Thanks.
Okay, well, another question, being new on council is, I guess I'm not understanding the current vehicle we have for interacting with you. I mean, I'll give you a perfect example. So
You're invited to all our meetings.
well, I'm gonna give you an example. So I came across this town council meeting agenda from the city of Chapel Hill, North Carolina, and at the top of this agenda, they put a language access statement. So in line with what we just talked about Catholic Charities, we have a lot of folks who speak additional languages and may find some additional information about how to get involved with city council and meetings and such in their language on top of it. So if I want to bounce this idea, I mean, I guess what would be the steps? Do I go to the city manager and the city manager looks it over and then takes it to you guys, or like what's our vehicle right now? Because you guys are a resource and I want to utilize you. I just don't know what that vehicle is.
Yeah, absolutely. I don't know if you want to answer. You can. So right now, we obviously work very closely with the city manager and the assistant city manager. Every single month, we meet with them. The chair and the vice chair meet with the city manager, sometimes the assistant city manager, to talk about what you're all seeing on your agenda and how we can support that. So you saying to assistant city manager, hey, this is really great. Why don't we have that? We would meet, put it on our agenda, be able to say, what are the pros and cons of this? Why aren't we doing it? Is this a recommendation that we can make to the city council? And the goal, right, as an advisory committee, is that recommendations that come from us are listened to in a way that have a lot of work from the Bangor citizens and from the community members that make up this advisory committee, that it's been vetted through people that not only are committed, volunteering their time multiple times a month to meet together to prepare, to work together in this lens of overseeing what the city council can do, but that we do all have very diverse backgrounds and areas of expertise. So maybe there are things that we would say, we don't recommend this because you didn't think of it this way, or is it accessible because of that? Could we do it this way? Everyone on our committee, I'll say, has so much professional and personal insight and experience that would really make such a difference to be able to hear those kind of ideas and weigh in hopes of being collaborative in that way.
Okay,
So-
so something all starts with you.
They're also public meetings, so folks are obviously welcome to attend those. And I'm sure most of the time the chair and vice chair would be happy to entertain a public comment as well.
Always, yeah,
Sure.
we would love to have as many people as possible that could come and ask questions, share these ideas. These are great ideas. This, you know, and that's something that seems simple enough, right, Courtney?
Yeah, I've never seen that. That's interesting. Yeah.
Yeah, thanks for sharing that.
Councilor Fish?
So you meet with, our city leadership about once a month?
Yes, we have a monthly meeting.
And the conversation is what about our goals as a city, and you provide advice, or do you come in and say, this is what we're finding from the community, and here's some suggestions? And my last question, what subcommittees are you involved with that you kind of formed?
Yeah.
To get,
Yeah, great question, because that is a lot of the work that we've been doing since it was founded, you know, in 2020. Here, we need this advisory committee. This is really important. Being able to do it in a way that balances the excitement and eagerness and passion of the people on the committee with what needs to happen for the city. And so that is why we created this policy, ordinances, and events and education buckets, so that every single one of our agendas looks at what policies from the city might we need to look at, that we could provide feedback on, what ordinances are happening that we could provide feedback on. And the education and events is usually, that's one of our subcommittees. People will come forward and say, you know, the Bangor Public Library is doing this really great event. Are there ways that we can support it monetarily, with further education, by volunteering ourselves there, by sharing more of this information? So those are the ways that we, again, Courtney and, the assistant city manager and the city manager will put things in that policy and ordinance bucket for us based on what is on your agendas, so that we understand what's coming down the pike. And then the subcommittees that we're working on are events and education. So for instance, making sure we have a table at Pride. There are resources that we can hand out, that we have stuff for people to do, and we can gather information from them. The accessibility committee, which would, instead of having every single member on the committee go through the website and read everything, you know, we have certain people that will report back to the committee on what they found. Human resources. This is embarrassing. I think of them. Human resources, and housing. Yeah.
Yeah.
Those are our subcommittees. So if there's anything that needs to be looked at, for instance, the Human Rights Campaign had a equity audit that Bangor did not fare well on last year. So that was something that we were like, hey, why didn't we get a great score? Where did we fall short? What could we do different? Really exploring, were they looking at things that maybe they were looking at the wrong website? You know, maybe they weren't up to date with what we have to offer as a city, and that's why we didn't score correctly. That was brought to us by a citizen, and being able to like look through that and actually identify what we could do differently. That's another subcommittee. Instead of all of us going on and figuring that out, we had one or two people look to it and report back.
very good, thank you.
Yeah, yes.
Could you possibly share that report with us?
Yeah, of course. Yeah,
Great, thank you.
yeah, of course.
Any other comments, questions? Council Mel?
What effect does the president's decision on closing DEI have on your group?
None.
We have not been made aware of any legislation that would affect our direct work, especially working with the city as an advisory council, an advisory committee. Unless
Oh, you're right.
we kind of look to the city manager and assistant city manager to let us know when we're sort of stepping out of the lines. But right now, there's nothing at a local level that would impact our work.
Your meeting minutes are on
Mhm.
the website?
Yes, yep.
Anything else? Thank you.
Wonderful. Thanks for the opportunity. I
Thank you.
appreciate it. Thanks for
Thank
the
you.
counselor back. This is really exciting.
Council Leonard?
I'm not gonna talk. I just want Courtney, are you aware I made a comment? You don't have to read it. I just want it recorded for a future meeting.
Yeah, I'll actually, or Katie, do you want to read it aloud?
No.
Katie's brilliant. And, yeah, it says, I would like to concur with Katie's point regarding a counselor to be assigned to the committee. This follows suit to what the council has already discussed and seemed to approve regarding having more council liaisons with our committees. I want to put this on a future GovOps agenda to have more of an in-depth discussion. Thank you, Councilor Leonard. We'd be honored to have as much involvement and support and partnership, obviously, with the council as possible.
Okay. We'll put that on.
Yes,
the
wonderful.
upcoming agenda.
Thank you.
Thank you all.
Thank you so much.
Thank you.
Thank you.
Deputy Chief Pelletier, do you want to make your way to the table, please?
Good evening, Eric Pelletier, Deputy Chief. No, we're looking for approval to apply for a grant through the Maine Fire Protection Services Commission. This grant would help us replace our live fire training facility, which is right now a little over 38 years old. Firefighters across the state are required to train, maintain, and be proficient at our skills before we get on the fire ground, and the majority of that for this area happens right at our training center. Question?
Is this an expansion of the current facility or a brand new location?
So it'll be on the same grounds. We have, like I said, the building now. Likely we'll keep that building, but this will be in a different location on the ground out there.
Other questions about the reason? Council Fish?
Would the grant cover, the 679,000?
Yep, it's no match from the city. It is a reimbursement grant.
Yeah.
So we put the money up front and then get reimbursed that.
Very good.
Council Beck, did you have your hand up or?
No, that was actually my question, so
Well,
we're
then,
good.
She's still your thunder. Any other questions or comments?
I move we approve this request.
Second.
Okay, it's been moved and seconded. This has come before us before. I think we all know about the training facility and how much it's needed, so. Is there any further discussion? It's been moved and seconded. Any objection? Seeing none, apply away.
Appreciate that. We do have a hiring process coming up, which will likely have some use of the facility in April, and like to extend an invitation. We'll get the dates for you out there, but I'd love to have you come out and see what we do out there and everything.
Awesome, that'll be nice.
Yeah, we'll be sure to add that to the list of tours.
Yeah.
And also, just so everyone knows, this order will be on the next council agenda for formal approval.
Okay.
Great.
Thank you very much.
Thank you.
Thank you.
Grace Ennis, there she is.
Yes.
Look, they're just coming right, they know now, they're coming right up. This is testimony for consideration.
Yes, so I'll just give a broad overview. I know you all probably know about the Freedom of Access Act, but this is a new law that would amend the Freedom of Access Act to require that we respond fully to every request within 30 days. This would be detrimental to a lot of departments because a lot of these requests can be very broad or very complex. And it frequently does take longer than 30 days to respond to these requests. A lot of requests that we get are very narrow and they only take a day or two to respond to. But some of them can be super broad, super complex, and require the work of several city departments. Within the law itself, it states that we don't have to shut down operations of a department in order to respond to a FOA request. And putting this 30-day deadline on it would require a lot of departments to shut down activities just to respond to FOA requests. So we would like to testify in opposition to this bill, and so that's why we're bringing it to you.
Okay, Council Trumbull.
I would be on board with that. Is there any language in the current ordinance about timeframe to say reasonable time or something like that?
Yes, so it requires that we respond within a reasonable amount of
Okay.
time. It does require that we acknowledge the request within 5 days, so we are in communication with the requester pretty much throughout the entire process of their request.
Will we submit testimony in opposition to this?
I just had a question, in the testimony, to me, what really made an impact, I think I emailed you about the body cam footage. And the fact that, you know, just to edit the footage, it's like 8 minutes to 1 minute of video to be able to blur faces and everything. And that's if the, you know, the request itself is specific. I mean, that's a huge time consuming. Hey, I got pulled over on Harlow Street. I don't remember what day it was, or, you know, and having to find it all. So you're talking, you know, 3, 4, 5 months to fulfill one request. There's no way they could do it in 30 days without hiring somebody, outsourcing somebody. I mean, you're talking, you know, $300,000, $400,000, $500,000 a year just for body cam footage alone. So I'm glad you guys are testifying against this. Thank you.
Counselor Beck, there was a motion.
Oh.
Were you going to make a second?
I'll second that motion, yes.
It's been moved and seconded. Is there any further discussion, questions? Seeing none, I believe you have your. Thank you.
Thank you.
And we have, oh, he's already there.
Yeah, save time. So, I'm David Sevchek, City Solicitor. I wanted to bring back to this, committee the, proposed written public comment policy that was already discussed at the January 13th meeting. Many of the items that were discussed at that meeting were in the draft already. This new draft, it provides another little bit of flexibility under the standing committee provision for the chair to allow a general public or a public comment period at the standing committee, because that was a unanimous suggestion at the last meeting. I would note that this policy is really written down what we already do for the most part. There are a few things in here that are tweaked, but the only one that kind of stands out is something that's a little different than what we've been doing every meeting, is the 15 minutes at the beginning of the meeting, followed by the chair being able to reserve up to 45 minutes for the end of the meeting. And that would be done as a courtesy to those who show up for the agenda items, so that they could get through their business in a reasonable amount of time. So I would just submit this for your consideration. One of the things in here is, I mean, that having a written policy would clarify things for the public as to how the public comment works. And it would also clarify that it's a limited public forum, and that's an important distinction. It already is a limited public forum. It's not an open public forum. It's a limited public forum, and the limitation is limiting it to limited to issues or concerns directly related to Bangor municipal government business. So it's got to be related to city business. And the purpose of that is to this is a meeting where the council is supposed to be carrying out the city's business, and you want to be able to have an orderly meeting, and you want to be able to remove obscene or truly threatening and overly repetitive remarks, as well as disruption and disorderly behavior that interferes with the orderly conduct of the meeting. And you can do that in a limited public forum. You don't have to allow every public expression, but again, we've already been doing that. And so this proposed written policy would have that into written form, and this is the results of the last with input from the last meeting.
1 second. This also includes the meetings of the standing committees,
Yes.
and that is up to each individual chair of those committees.
Well, it's the draft says no general public comment period will be conducted at standing committee meetings, workshops, emergency meetings, or special meetings of the city council unless it is required by law or contains a public hearing agenda item specifically. That's what we already do. The part that was added since the last time was that the chair of the standing committee has the discretion to alter that limitation on general public comment period at standing committee meetings. So we just added a little bit of flexibility there that the chair could override that general rule.
Councilor Trump?
Just a couple of questions. One, under the general public comment, what you can not comment on. I just have no problem with these guidelines, just wonder if there will be any freedom of speech issues, like when you restrict somebody from endorsing somebody for political office or something during general public comment, we have no problem doing that.
Yeah, and the general public comment period is a limited public forum,
Oh, we can
limited to
be
city
restricted,
business, and in a limited public forum, you can restrict the subject matter of the public comments. It's not open to anything that anybody wants to talk about.
yeah.
It never
No
has been.
soapbox, right? So my other question is, no, I'm fine with the general public comments. When there's agenda items, I've got a question, and I don't think this really speaks to time limits in this. Is there anything about time limits in this? Did I miss it?
There are time limits in the general public.
Right, but in the past, I know in some
comment.
committees, not council committees, but appointed committees, the planning board. I think they've replaced time limits on public comment, not general public comments, but when there's an item on the agenda. I've got an issue with that. I mean, sometimes 3 minutes is not enough time, especially a planning board issue. If you're talking about something that's gonna affect your house or your neighborhood, I mean, how did they come about with the planning board decided to limit people on public comment?
This written policy does not apply to the planning board.
No, I know, which
So it doesn't
it's
speak to
understood.
that.
I don't, how are they been, I mean, we're talking about public comment on everything. How do they do that?
They have their own bylaws that,
Right, but we oversee the planning board. I mean, they can't,
correct, this,
you know, be.
this written policy did not
No,
intend to
but if we'd like to
incorporate
say the
everything.
planning board, you're not gonna limit people on public comment, or even if at the council meeting, if somebody comes to the council meeting on a Monday night and we've got something refers to the planning department, I've seen sometimes where people wanna talk and they hit the 3 minutes. And you know, in a general public comment, I don't have a problem, they could submit written testimony, but if it's an item that's on the agenda, these arbitrary time limits seem sometimes restrictive. I know you wanna hear from everybody and we've got a lot of business, but that's our job to hear from people, so, I don't know, I just wanna throw that out. Maybe this is not the right point, I don't know.
Well, having been on the planning board, I've never known them to limit the discussion from people that are submitting applications. I
Well,
think
from the
they're pretty-
public they have, I mean,
Currently
just,
up to the
not-
discretion of the
really.
yeah,
chair.
just the issue like off of,
Not on the
For
planning
Broadway
board, they
last
never
year.
did. We've always gone,
well, you missed a couple meetings last year.
I wasn't on it
Yeah.
last year.
Right, I'm saying, you missed.
There have been times like the project, when there's
Right,
an enormous number of public to talk that, where they have limited the time period for the public at planning board meetings. It's up to the discretion of the chair at this point,
So
and
stated
this
in
does
the
not
charter.
address that. What's that?
So stated in the charter, it's up to the planning board? Or is that just?
The charter has
unwritten?
the planning board has its own bylaws that.
Is that in their bylaws?
Well, the fine details of the bylaws, in this regard, I haven't looked at lately, but generally speaking, it's the planning board chair who's got the discretion.
Okay, just 1 second. We've got a comment up there. I fear citizens might be easily confused regarding the limitations of public comments for standing committees. What happens when a situation occurs when one chair regularly allows public comment and another allows zero public comment? Question. Good question.
Yeah, that's a good question. There are currently at the standing committees, we generally don't have public comment unless it's legally required or specially asked for and put on the agenda. And so the way that this written policy, it allows the chairs to have a public comment period, but it doesn't require anyone to. In fact, it states that we don't have those periods unless the chair. And so it defaults to no public comment, general public comment period during standing committees.
From my perspective, I have allowed public comment off and on for quite some time. If there's people that want to speak,
put on agenda items, not general public comment.
they're allowed, right?
Yeah.
They're allowed to speak on the topics that we're covering. It's not the same as the council meeting comment where we're gonna say, okay, we got 15 minutes of open public comment. But if we're going down through the agenda and people want to speak, if they raise their hand, I'll acknowledge them and I'll even ask them to come to the table. So I think we owe them that. If they're coming and they're interested, I think they have a right. Now, if somebody wants to sit there and yammer for 45 minutes, I'm probably gonna have to cut it because we only have so much time with other meetings behind us. But it's just, it's the right thing to do and, I'm a little confused here. You're going fast. What's new?
Sorry, right at the top.
We should take one stand regarding these committees. Either we allow public comment or there is no public comment. Allowing the chair to grant public comment is too problematic. What's the council's pleasure? I mean, we can
I
certainly.
think we're confusing two. I think one issue is general public comment and one issue is commenting on an item on the agenda. I don't see any reason at the committee level why we even have, I think at the discretion of chair is fine. But I think every committee needs to allow public comment on an agenda item. But that's different
how
than
that's
general
written.
public comment.
Correct.
And that's in there now, right?
Correct.
No. I didn't get that impression.
Yes, it
They don't have, they can allow, but they don't have to.
That's general public comment, not agenda item comments.
I thought that was on agenda item comments too.
Will be allowed
during
regular council, sorry.
No, that's.
On items requiring public hearing and on other items appearing on the agenda, which the council or committee is taking action upon.
So it is in there.
Yeah.
Yeah, correct.
Okay.
Yeah.
It's just general public comment that isn't allowed at the
Right.
committees,
Okay, yeah,
because
well-
this is your work session.
Yeah.
What about?
If it's on the.
Maybe we could clarify general as being items that, something that's not on the agenda. So
can speak.
so it's clear that we want to hear
I
from.
would assume.
Council Ledger, does that
I don't know.
address what your comment is? That it is there, that the council does or should be allowing public comment. I see a thumb. Okay. Council Pelletier.
One clarifying question, and that's in section C, item 2. Individuals, employees, and employee groups discussing matters for which complaint or grievance procedures are in place. At last Monday's meeting, we had a large group of folks representing or who were represented by a union.
Mhm.
Are we saying that they cannot come and do that public comment? Because to me, that is an important way for us to understand dynamics of what's happening with the city.
The grievance procedures in the,
They didn't file a grievance.
I don't know.
that are in place, that,
Yeah, I mean, I think, that, what they are complaining about actually isn't grievable. So they are generally told that they would be allowed to come speak at public comment the same as any citizen would be allowed to.
Okay. Just don't want to limit that kind of feedback.
Council Mel?
Advisory committees, public comments allowed. If it's on the agenda, it's allowed, but it doesn't mention anything about advisory. committees.
this was only intended to cover.
Yeah, I know.
Standing
Yeah.
committees.
But we do have, we had an advisory committee here just a minute
No,
ago.
standing committee of the council.
Yes,
Yeah.
There are only 5 standing committees. of the
I know
council.
that.
Yeah.
but I'm saying, what's the procedure with an advisory committee? If it's are is the public allowed to speak at an advisory committee meeting?
I mean, I think generally they would be open to that, yes, but that would not be covered under this
No,
policy.
I know it wouldn't,
Oh,
but I'm
okay.
just asking, why isn't it? I mean, if we're if we're doing standing committees, it'd be just as easy to include advisory committees with it also.
The council could do that, I think.
Council could do that, or the council could say, why don't we work on that next? It's up to the council, it's up to you.
Why don't we have the advisory committee advises?
I see all this movement and I'm like, oh, does somebody want to speak or, okay.
You gonna let the public speak?
If they want to. Come forth.
Well, I'm just,
The chair over there.
no, I don't need to say.
Two chairs right there.
Just questioning in regards to the comments. At what point, I guess, are the taxpayers able to come and speak and give our opinions? Or not even our opinions, if we have a question on the agenda, like as far as the advisory committee and all of the things that they've done, that's great. They haven't had a quorum for the last, 3 or 4 meetings? So what has that group really done? So I mean, I have quite a few problems with it as a taxpayer of the city of Bangor. We should be able to come and ask questions. We shouldn't have to always send emails back and forth because we might not be the only citizen that would like to ask the same question or doesn't know how to, or is scared, or, so and so. And I really think that the council as a whole is impinging the rights of the taxpayers, and we're the ones that elected all of you to have the ability to come and speak. So what say do we have in our municipality and our government? That's
Sorry, can you state your name for the record?
Hillary Simmons.
Thank you.
Resident of Bangor.
Thank you, Hillary. I think your question is answered with this in the standing committees. They're still talking about the advisory.
If the chair will allow it, not all chairs will allow it. And it also depends, I'll be honest, it depends on the chair.
We've got to get her closer to the table so she can.
Not
think.
all chairs will allow public comment, and it depends on the chair's personal beliefs in that situation. And again, we need to get our personal feelings out of the matters. These are professional. You don't have to agree with everything I say or anything that someone comes and does a public comment, but you need to be respectful and let everyone have the ability to have a public comment. Thank you.
Okay. Anyone else? Council Fish?
I think Hillary's statement is similar to what Councillor Leonard had asked, that then we may have to come up with something that's more consolidated, like, if it's up to the chair, some public may be able to speak and they may not. It might be how the chair feels that day, maybe.
It's, just to clarify, in item 3, it says public comments will be allowed during council and standing committee meetings, as long as it's an item on the agenda. So that's not leaving it up to the discretion of the chair. It's saying we're doing it. Am I misreading that? That's what I came up to say.
Okay. That's right.
That's how this
That's
is written.
right. Yeah. We're just talking about the general public comment. Not the agenda items, allows for public comment at the standing committee level.
Oh, okay. That would convert.
And again, I asked the question, why just at the standing committee level? Why not at all committee levels?
Well, when we first drafted this, it was just supposed to be for the
I
city
know, but
council
it's-
meetings,
how
and we
difficult is
expanded
it
it
to
to
change it?
standing committees and,
What? We take standing out, it's all committees, right?
Standing committees are standing committees of the city council.
I understand
If you
that.
want to talk about council appointed committees, that could look very different depending on the committee.
Right.
I'm just saying there are different, so for example, the appeals board has a very different layout and configuration than the planning board does. And the planning board, many of the items are coming back to the council, but some items the planning board has authority over. Advisory committees are gathering of information. No action is taken other than if there's an action recommendation, it comes to a council committee, at which point there's an item on the standing committee agenda.
Okay.
Which is why Attorney Subject was
Oh.
saying we may want to
Change it later.
do that as a part 2. I mean, I'd like to see something move on this piece. Get this in there, get it in the works so that everybody's in agreement with that. And then we can always bring up the council appointed committees and advisory.
Correct.
And do it again.
And they may have to be, more individualized.
It may
you
be
know,
very
and
different.
not
than
one
that.
size fits all.
But it certainly isn't something we can do tonight. So is that the pleasure of the committee that we look at that? The additional council appointed committees? In future? If you're not, we're not gonna do it. Is there enough that are interested in looking at that? We'll put it on a different agenda and start the process anew, but this we should really act on.
Move the question.
You're gonna move it?
Yep.
Okay. It's been, we have a motion.
Maybe no question on who would move.
I was gonna say, what was the question?
Yeah,
No,
he's making a motion.
Oh.
To what though?
Move the question and
That-
approve this.
Okay,
That this
to
item,
approve the draft.
the
Yes,
draft will go forward.
To full council.
yes.
Second.
And now it has been seconded. Is there any objection? Seeing none, this will go to council. And would you put that on another agenda, Courtney, for the other?
For the
So we
appointed
can start,
committees?
yes.
Okay.
The council appointed and we'll start looking at that. Because it's probably gonna be very different. Everybody good with that? Okay. Is the superintendent here? Lori?
She's on here,
She's
online.
up there.
Yeah.
Okay.
So, just because it's getting a little late,
Mhm.
I did include a memo, that, provided some history over operational history and overview of the community connector, as well as our staffing and operations. The fact that we are holding an internal CDL class that currently has 14 individuals in it, which is fantastic news. And I also provided a few other things that I just wanted to highlight, and of course, we can answer questions and Lori can highlight anything that, I may have missed. But just, in quick summary, the Community Connector Services, Bangor, Brewer, Hamden, Beasley, Orono, Old Town, and the University of Maine. All of those different entities pay into the system to basically divvy up the local share, as a lot of our funding, our expenses are covered by federal funding. We are audited as a result of that federal funding by the Federal Transit Administration every 3 years. And there's, of course, lots of requirements that we must comply with to maintain that funding. I gave a little bit of history in terms of dates and how things have evolved over time. We currently have 11 fixed routes. Those are the bus stops that you see along the way. Those are the big buses that go around. Right now, our system is set up for 2 daily shifts to cover each route. And then we have what's called the Black Bear Orono Express, or Route O, that follows the University of Maine's calendar school year. And then, of course, we operate ADA paratransit service, which is door-to-door service for those that qualify. And those are based on demand, and we cannot deny those rides based on capacity constraints. And over time, we have seen an uptick in that demand, and in fact, we are now up to 8 vans to meet it. In fact, we have as many as 90 trips in one day within our service area. And so we also, right now, we have between 38 and 42 driver positions that cover both those areas. And we need between 33 to 35 drivers per day to cover the need. And of course, those have to accommodate call-ins, medical leaves, vacations, and things of that nature. There are a lot of challenges that have come with qualified applicants over the years, everything from recreational marijuana to reduced opportunities for folks to get their commercial driver's license, and a new federal law that requires entry-level driver training. Previously, you could kind of read a book, send in for a test with no proof of any hands-on training, for example. And now there's classroom time and road of range time that is required in order to become a CDL driver. Of course, what our drivers do is really important for our citizens. They need to be customer service oriented and be willing to drive that big bus through traffic on that regular route, which is quite different than what other professions might do with the CDL, such as driving a dump truck. And so one of the things that we recently did with some grant funding was put on another internal CDL class to hopefully rebolster our numbers and hopefully get us back to Saturday service sooner rather than later. As I mentioned earlier, we have 14 individuals in that class. They all must pass licensing requirements before becoming a transit driver. But fingers crossed, it is underway and things appear to be going well. We have also made a few internal structure updates recently. We had a longtime operations manager retire. And so that kind of gave us the opportunity to relook at our structure. And we wanted to elevate that position into a transit operations administrator to give Lori Linscott, currently our bus superintendent, soon to be transit administrator, to work more on grant compliance, finances, FTA regulations, and project management duties. So hopefully this creates a little more internal capacity to better support the growing system. And then just real quick, we all know that fixed stops have been implemented. There was a 6-month transition period that ended in January. We continue to have those conversations, and one of the big pieces that we've been trying to educate folks is how to navigate. You don't have to be, for example, right next to a stick in the ground or the sign for the bus stop. You can be within 20 feet to be picked up. And we obviously want people to stand where it's safest. We have implemented some winter maintenance protocol. And of course, we know that a lot of those stops will need to be built out with better infrastructure as we move along. We just wanted to start with sticks in the ground, so to speak, to make sure that where the locations are make the most sense before investing further dollars into those bus stops. And then last, of course, is technology implementation, everything from the automatic rider counters to the automatic vehicle announcements, and the automatic vehicle location to help with the new rider app, where you can actually see in real time where the buses are on the route and where the closest bus stop is. Our goal is to actually integrate eventually with trip planning through things like Google and other apps that can help folks better navigate that system and hopefully increase ridership, which I did forget to include ridership in that report, so I apologize, but actually I'll make sure that that ridership is uploaded to the Community Connector website in the coming days. Lori Linscott, if you are there, is there anything that I missed that you would like to touch on? Are you there?
Yes, I'm here. No, you did a good job. Can you hear me?
Yes. Any questions or anything?
Councilor Trumbull, you had your hand up.
Yeah, well, you mentioned paratransit, and I know we used to contract that out, and sounds like it's ballooned since we brought in-house. The cost of that is quite staggering versus the regular bus system. So is the cost of that still allocated the same way? Is it just part of our regular budget? So all the communities pay the same share for paratransit?
Yeah.
Even though they might not take in paratransit as much as they.
Yeah, I believe, and Lori can correct me if I'm wrong, but it is all encompassed in, like, it's kind of separately tracked, but it's all part of the operating budget, and that local share is divided based on revenue hours of the fixed route system. So, yeah, in which we share or cover approximately 62% of that local share. Lori, is that anything you'd like to add?
No, you're exactly correct.
Other questions, comments?
The grant that we went to get the training, is that something that they're gonna offer every year?
Lori, do you know?
No, I don't think so. We got that through DOT.
Okay, the reason why I asked is, things happen and Saturday service gets canceled. I think this is twice in the last 3 years, I think. And so I guess I'm wondering, is there a plan in place, like a threshold that says, okay, when we get to this many drivers, when we get Saturday service back, but people are leaving, people are quitting. So we've got this, we need, whether it's the budget process or what, that we set aside money, what's our backup plan? Are we gonna go and do more classes again? Is that how we bring Saturday service in the back or bring it back? I guess I'm just trying to think of ways to prevent this on and off again cycle that we've been going through.
Yeah, and I think that that's a very important question. I think that the answer to it is probably not a straight, simple answer, but it's going to be many things that need to come together, including, like, for example, right now, all of our drivers have to have a CDL. but you don't actually require a CDL to do the ADA paratransit service. So if we're able to separate out those two separate classifications, it could allow more resources for those with CDL to drive the fixed route and be easier to fill the ADA paratransit side because that licensing requirement would no longer be there. Now they'd have to still get drug tested and things of that nature. And then on top of like the structure changes, we're always evaluating, because again, our system came online back in the 70s and the way we've operated has been longstanding. And so we are hoping to continue to evolve that, especially with technology, to help us do a better job at making changes that hopefully better support the system paired with, for example, our wages have increased significantly since the pandemic. I don't believe they're quite where we would like them to be in comparison to other similar positions with the CDL. It's just what can the taxpayer absorb, for example, and what can those other communities afford? So we're making progress in a lot of ways. Unfortunately, it doesn't seem to be fast enough for things like Saturday service.
Sure. Well, no, that's exciting, the 14 drivers in that class, you know, if they all pass, that at least gets us in a better position. And it
Yes.
does sound like you're thinking about ways to kind of stop that cycle, so.
Yeah, we
Good.
really are trying. We understand, we hear from our passengers and stuff, how important Saturday service is. And the worst thing, in my opinion, would be to try and bring it back and then have to do away with it again.
Yeah.
Because we couldn't sustain it. And so there is a sort of a magic area where if you have too many drivers, you know, you have to expand into Saturday, but you have to be careful if you expand into Saturday, can you cover all of those shifts across those 6 days? So it is a little bit of a tightrope, if you will, in terms of that balancing that, which kind of leads me back to the structure and how we're set up and things of that nature.
This is not the first time that we have put the connector update on an agenda and they were at the bottom and they got shortchanged. So I would like to have us have another session with them, maybe another month or so, whatever, to really talk about some of those same issues with the Saturday. We hear from constituents constantly how important this bus is. And I think we really need to take some time and give, you know, Superintendent Linscott some time to really better a nice conversation about it, where we're going, how we're gonna get there, what can we do to help as a council. So if possible, I'd like to have another session, them closer to the top of the agenda, maybe on a lighter time, because this is really this was a long agenda to do a full update. And there's a lot to it. The connector's a big thing, so.
We'll definitely come back.
All right. Yeah, he's writing something. Oh, what is the likelihood that the ADA trans and bus trans systems can be separated in the future to mitigate these driver barriers?
You mean to separate out the two classifications to help with the licensing requirements? Yeah, we actually have a meeting with the union on the 12th, and that is at the top of our list to chat that through.
Great. Councilor Dean?
When do you anticipate the students to graduate with their CDL?
Lori?
Graduate from the classroom. They'll graduate this Wednesday, but then they have range and road, and that will just be on their own skill level. So there's no really way to tell. We're forecasting probably end of March, 1st of April.
Once you have enough hours and comfortability behind the road, you have to send into the state to actually take the test. And so and with that many people, you have to get them all time in a bus, and so it's a lot to schedule out, hence why it could be April.
My thought was to wait on the meeting until after we knew the numbers, but maybe that's too far out. So I mean, that would change a lot of our input, I think.
Again, we'll play that by ear. How about that?
Yeah.
Yeah.
See how the agenda's looking.
Sure.
Anything else?
Nope.
Does Lori have any final comments?
No, thank you. Thank you, guys. I'll be happy to come and speak with you.
Right. Look forward to it.
Great.
All right. Is there anything else on this agenda?
Nope.
Then We are adjourned at 7:05.
All right.